Hey guys, recently I've been asked if I can do a rhinoplasty while the patient is awake. The simple answer to that is yes, you can do a rhinoplasty with a patient awake. However, is it the best thing? I have some really strong opinions on this. I think that anytime a patient is uncomfortable during any procedure, it makes it much more difficult to get a very nice result. So there's a lot of reasons why the anesthesia component is very important during whether it's a first-time rhinoplasty or it's a revision rhinoplasty. Oftentimes, even though those procedures may be done with the patient awake and just have some local anesthesia injected, there are some anxiety-provoking moments during rhinoplasty. Things such as bleeding. The simple process of bleeding from your incisions can sort of dribble down the back of the throat, and it can sort of give people some anxiety. The other issues are going to be related to the maneuvers we need to make during rhinoplasty. For example, when we're cutting bone, when we are shaping the cartilage, sometimes these areas may hurt a little bit more potentially, and if you don't have excellent local anesthetic block at that moment, then yes, that can also produce some anxiety through pain. And finally, rhinoplasties are not meant to be done in record time. I typically take a lot of time doing my rhinoplasties because it's the middle of your face, so it's very important to get that right. If you rush that job, sometimes that's very apparent. The nose does not do well with slight irregularities, deviations, anything that was left behind. And I think that you can correct a lot of that just simply by slowing it down a little bit. But of course, if you slow it down, that extends the period of time that a patient needs to sit there if they're getting this done with local anesthesia, and it becomes very difficult, also producing more anxiety. So with all that said, if it were me, I would definitely want to sleep for my rhinoplasty and not be awake for it.